Thank you, Chair Griffin, for letting me wave on to this important hearing. I want to thank all of the witnesses, and I want to thank for what you do for the American people. And it's amazing the progress we've made in research and development. The rising cost of prescription drugs has been causing significant burdens for millions of American patients and seniors. Far too long, Americans have had to choose between much-needed prescriptions and household expenses. That's why I'm glad we're having this hearing today, to explore solutions to lower the cost of care for Americans. Now, I had a really great experience with my pharmacist on Monday before I left to come. Usually he is there to complain to me, but he came and he says, well, can I speak to you a minute? And I want to give you some good news. He said, Eliquis, which is a drug that's used, he said the price is substantially down. And he said, furthermore, we're making a little better than $1 when we sell it. And before, we were losing a lot of money selling it. The only problem is my accountant says revenues are down because drug prices are going down. But I said, you know, are profits up? He said, yeah, profits are up. So that's something that corporate America could learn, I guess. But that was good to get that good news. And I told him I would spread that. Mr. Gilbert, insurers and PBMs often go against doctors' orders by requiring patients to step through multiple medications before they can receive their originally prescribed medicine. This happens in the Part D market, the commercial market, and now in the Medicare Advantage market for Part D drugs. With the Safe Step Act, which I introduced earlier this Congress, help hold insurers accountable for increasing the use of step therapy leading to non-adherence and access issues. Mr. Gelfand?
Oh, thank you, Congressman. We believe that reform to step therapy does make sense. And for instance, it should all be electronic. It should not be faxed on old fax machines, and it should be timely when patients need an answer. But we also believe that medical management is important.
Okay, thank you. Ms. Riley, in other countries, patients have access to fewer innovative medicines. In the U.S., 85% of new medicines are reimbursed versus only 24% in Australia and 21% in Canada. In the UK, uptake of new cancer medicines is only about 8% of what it is in the U.S. Patients in other countries also wait longer for their medicines on average. OECD countries have access to 18% of new medicines launched within 1 year of global first launch. U.S. patients have access to 78% of new medicines within 1 year. But I still hear from my constituents that they have all kinds of hoops to jump through before they can access these groundbreaking therapies. It is critical that patients are able to access the medicines they need to treat their health conditions. Could you please explain what the biggest barriers to patient access in the U.S. are and what can be done to address those barriers?
Yes, thank you for the question. I think the first step is today there are 1,453 medicines that last year got excluded from the big three PBM formularies. If you look back 10 or 15 years ago, when a medicine was approved, it typically was available to patients. That's no longer the case. Large numbers of medicines get excluded. Once you've actually gotten on the formulary, it doesn't necessarily mean you're going to get access to the medicine. If you're in Medicare Part D and you're prescribed a brand new medicine, half the time that medicine's going to get denied originally. You're going to have to jump through a hoop, prior authorization, some form of utilization management. And in the commercial market, it's 70%. So yes, your patients or your constituents are experiencing a lot of what we are seeing, which is the hurdles continue to go up. We also now have high deductible health plans. 80 million Americans are in a high deductible health plan, which means when they go to the pharmacy before they've met their deductible, their insurance company and PBM are charging them the full list price of the medicine, not the negotiated price. As a result, the PBMs and insurance companies are making money every time that prescription is written. In fact, a GAO looked at this in Part D and found of the 100 most rebated medicines, in 79 cases, 79 out of 100, the PBM and insurance company made 400% more than what the patient was paying for the medicine. So this is not a system that is sustainable. We have a great system in America. Patients do have availability of medicines, but the hurdles that get put in place are significant.
Well, I thank you. My time is up, but I will say this. I'm going to do everything I can in my time here to correct this problem. It should not be going on in our country.
The gentleman